Affect Autism in its 10th year of providing free supportive content for your DIR journey.
All of Affect Autism's podcasts are produced and edited by Daria Brown. Please note that the views expressed during all episodes are solely those of the individuals involved, do not constitute educational or medical advice, and do not necessarily reflect the views of Affect Autism, Daria Brown, nor ICDL and associated parties. Listeners should consult with professionals familiar with their individual circumstances for specific support.
You're listening to the We Chose Play podcast from Affect Autism, where affect is the #1 tool we use in supporting development through playful interactions. Welcome back, Floor Timers. I am very excited to have a new guest this week. Dr. Angel Bell-D is a DIR Floor Time expert and training leader in the Philippines who started the Growing Brain PH, a DIR accredited clinic that began as a social media page. She is a medical doctor who has a background in public health and community-based programs and program development, and she fell into the world of infant mental health and parent coaching through Finding Floor Time. She teaches both online and on-site courses for the International Council on Development and Learning. Welcome, Dr. Angel, as you're called by your patients.
Hi, Daria. Hello, everyone. Thank you for having me.
Thank you for taking the time because we're about 12 hours apart, I believe, in time zones. So it's great that we were able to find a time in your busy schedule. Tell us about your background and how you found Floor Time.
So, as you mentioned, I do have a medical background. So, I have a medical degree and a business degree as well, actually, which is what brought me into that field of public health. And so, when I graduated medicine, I initially thought I'd do like pediatrics training and doing hospital-based work just because I love kids. But then I ended up working in a developmental center about over 10 years ago. And I ended up being this clinic manager. And at that time, so that was about 2016, we were trying to think about early intervention. And lo and behold, Virginia Spielman came to the Philippines for DIR 101. And so that's sort of how Floor Time became known to me as a professional, and just kind of realizing that this framework, this relationship-based approach was something I kind of wanted to learn more about and see how we could frame early intervention programs for working with kids.
So yes, DIR 101, an introduction to DIR and DIR Floor Time, the intro course at the International Council on Development and Learning. I'll put a link to it in the blog post for today's podcast episode. Working with the autistic population, is it mostly behavioral services, or what was the climate and what did the developmental approach that Floor Time brought offer?
The climate for the Philippines in terms of interventions up till now is actually still more behavioral in nature. But if I think about it in terms of being in communities and working with families, it really jives well when you think about it from a cultural lens of Filipino families, which is very family centered and community based, which is the foundation of our DIR, which is the relationship as well. But it's definitely not the approach that is often taught, especially in the academics, in interventions, let's say in OTs and speech and other interventions, even our psychotherapies, are a lot of them are behavioral or cognitive behavioral in nature. So much so that now that I'm a training leader and trying to introduce DIR, I love the reaction of some of our therapists who'll be like, that makes so much more sense for me, or that feels so much more meaningful when we're introducing the DIR framework. And I think that's one of the beauty about getting to teach it here now, but it's certainly something new, something very novel for the communities here as well, both for our therapists and even our parents and families that we're working with.
And I know that you have a wonderful YouTube channel that I've seen some of your videos. Do you find that kind of social media, I don't know if you consider YouTube social media, but I guess it is kind of social media. Do you find that really brings people to Floor Time, or do you find that it's more word of mouth through your patients, or kind of a bit of everything, or through professionals taking your classes? I guess all of the above.
Well, first of all, I'm quite amazed that you found a YouTube channel. I can't say I'm a YouTuber very much. There was a time in the pandemic where I did have a little bit more time and recorded some videos, but I'm not very good at keeping up with that. It's not like affect autism and we chose play, but I think there is a community in the Philippines that do follow social media and YouTube videos well. I'm just not very good at updating it. So most of floor time here in the Philippines has been more word of mouth. I think I do get a wait list. I hate wait lists because that just means we're not helping families fast enough. But it also signifies that the request and need for floor time coaching is actually growing as well. And even to the point that we have professionals asking, when's your next class? I'd like to join another class because they're also starting to get interested. I did a 101, an introductory course last February, and we had to close registration just because I couldn't manage a huge class. So there is a growing interest.
Do you find, I know that sometimes here people will take the DIR 101 course, the introduction, and it really is just an introduction, even though it is 12 hours. A lot of times, some people will take it and they'll sort of be up and running, which is wonderful. But without those certificate classes, it's really hard to understand all of the nuances that come up. And do you find that that interest continues? You mentioned that you then go on and teach the basic certificate course 201, the proficiency 202, and etc. Do you find that there is that interest to continue those certificate courses there as well?
Well, that's a tricky question to ask because I agree. There are some who may to do the 101, and a favorite question I always get is, can I practice floor time now? Right. And it's always explaining to individuals that, yes, you can always practice a relational based interaction with your families. And it's still going back to letting them know the value of going through the certification courses because there is so much to learn in terms of how you can grow as a professional and the interactions as well. So I think when we get to explain it from that angle, there is there are two types of participants. The ones that will be like, so when is the 201? When can I attend? And I'm ready to dive in. And then there are those that will say, well, let me take a look at it and let me think about it. And maybe there's a subcategory to that in terms of those who may not have resources
Mhm.
to pay for a class as well, because they are trying to balance out finances. If you think about interventionists in the Philippines compared to those outside of the country, they actually earn much less compared to those that are outside. We actually lose a lot of our very good clinicians because it's a basic need, right? Finances is a basic need as well. So those are just kind of the nuances that we have to think about when we do trainings as well.
It's always a barrier for sure, the
Mhm.
accessibility. And it's part of why I wanted to make Affect Autism too, to have so many rich discussions with expert training leaders like you to just keep people that are interested really thinking about all of these things. I think floor time is one of those things that it's a pretty easy concept to grasp, but the more you learn about it, the more you feel like you need to learn. And people that
I have to
seem,
agree.
yeah, people that seem overly confident about understanding it early on are the ones that probably need to learn the most about that.
Yeah.
All of the nuances of really, getting that attunement and that whole concept of child led and following the lead, which is so, so misunderstood. So I will put links in the blog post to some of the stuff that we're talking about. If for some reason people aren't familiar with DIR, I have so many things on my website that explain it. So we won't dive into it here. But what I'll ask is what does a typical week, I guess, look like for you? Like, are you still practicing medicine too? Like, how does your day-to-day job look?
My day-to-day job, that's a complex one, Daria. Um, so I wear many hats. Clinic is just maybe one third of what I actually do for a living. Um, when I say clinic, I do get to see patients. And when I say patients, that's the parent coaching and the intervention. And there is a mix of medical consultations there. I'm also in the academe, so I do teach medical students, and that is a way for me to kind of introduce some of these relational concepts to students. In addition to that, I actually do research. So I'm trying to grow a body of data, I guess, for autism in the Philippines. And one of my big, hairy, audacious goals is actually to culturally make DIR more relevant in our context as well. But maybe on the day to day, so I do clinic maybe 1/3 of my time in a given week. I might see as much as 4 to 5 patients in a given day. And what happens is I meet with families as a whole. So they could be coming in for a developmental screening, or they could be coming in for a medical consult or checkup. And so I just kind of do the checkup, the medical things. But what I love about being able to do floor time is I get to demonstrate some of these interactions with children. And it's become more known for individuals to come to see me when their child has autism, or if they might have other developmental delays as well. So those are the kind of caseloads that I get to work with. And that's also where I get to put in a bit of that parent coaching as well. But in addition to that, so when parents think that that's like very helpful for them, I get to see them for a few more sessions after that so that I can kind of support their work at home, I guess, and the way they interact at home, with the main goal of building a relationship or building their relationship between parent and child, especially when they see the connections that we try to form in those sessions. And then what's really nice about being an accredited DIR organization, the only reason why we were able to do that is because the other clinicians in my clinic are also DIR trained. And so I get to hand them off to these practitioners in the clinic that are following the same principles and frameworks and values. And the parents are really happy about it because they understand what the interventionists are doing. And at the same time, they get to continue at home and to be able to do that same approach and feel like they're part of that team of what Growing Brain is trying to establish.
I love it. And I think some of those other practitioners that you work with were on the YouTube videos, interviews that I saw with you, or the discussions.
Yeah, they were.
So, how is the neurodiversity movement in the Philippines and awareness of autism, and how is it, on par with where it is in other places? Is it different? I mean, there's so many cultural differences.
Yeah. I think that there's a growing awareness of it. We have our own Autism Society for the Philippines. Um, I'm personally a member, as a professional, I'm a member of the organization. But I can probably say that in terms of neurodiversity, it's something that's in its emerging stage. It's just starting to grow in terms of advocacy and self-advocacy for autistic individuals. And I have to think of these words very carefully also, because I was having a conversation with someone the other day who was talking about, um, let's say in the Western countries, we use terminologies like autistic children. But in the Philippines, there's still some sensitivity in terms of what is the correct terminology, right? Is it child first? Is it diagnosis first? Is it a child with autism or an autistic child? And so that's it's still a debate that's kind of ongoing for us here. And so I always, when I train, I always say that I am aware that for us, we're always a child with autism is child first before diagnosis. And if I slip up, because in the ICDL community that I get to work and be with a lot of times, we do recognize them as autistic individuals, and that may be a preference for some as well. So that's just one of those cultural differences we tend to still have. There's definitely still some stigma, and I can't even say some. There's definitely stigma present. I I get a lot of questions of, will my child be normal? Will it ever go away? So kind of still seeing it as a diagnosis or a disease of sorts. And there's definitely room for growth for us still there. But it's gradually shifting. it's gradually going in towards that strength-based approach. I like and love the ability to have a clinic where everybody thinks in that way. I had an OT that just sent me an email recently that said, "Hey, can I join your clinic? Because I'm just really looking for a neuro diversity or neuro affirming place to work at." I was like, "Welcome. Please do come." And so that's where we're at.
So, have you had the opportunity to watch the growth of some of the people that maybe come to you when their child is 3 or 2 and just get diagnosed? And also, do you diagnose children? And then see them a few years later, like not, and I'm not talking about the children's progression, but the parents. Like, have you had the chance to witness the change from thinking this is a disease and something's wrong to embracing who their child is and understanding and all of that? Do you get the joy of seeing that progression?
Definitely, I got that joy just today. Well, I get it often enough. I got that today because so the clinic itself, so I've been practicing for almost 10 years, but the clinic itself is about 5 years old. So I have a kiddo who's probably been with us for about 3 years, perhaps. Started with me as a parent coaching because got referred from a developmental pediatrician. And then I just kind of transitioned them to OT and speech. I'll answer your first question first. So I don't get to diagnose because I'm not a developmental behavioral pediatrician. As a practice, we do rely on our specialists to be able to do that locally. But as a medical doctor, I do get to talk about the, the symptoms just from a medical perspective, we just call them symptoms, right? And just kind of look at them in terms of strengths and vulnerabilities. And that's sort of where I bring it in my medical practice. But going back to the story of the little kiddo and family that I worked with was, I love this family because when they first worked with me, it was mom, dad, and little kiddo who was there, who at that time was non-speaking. Um, and we talked about the framework of DIR, we introduced the theories, and then we did play. And I watched the dad go from observing our sessions. It was just usually me, mom, little boy. And then dad would come down to the floor and play with us. And then I have these handouts, these workbooks that I send off to parents. And maybe 3 or 4 weeks in, he comes back and says, "You know what I realized? This also works with my teenager." I was like, "Oh, that's perfect. That's great." Like thinking about it from the relational child led. And I think at that time, a teenager was transitioning from being the happy go lucky, let's play to quote unquote, those darker self involved kind of play. I think was what was he was experiencing, and this approach of child led and watchful waiting was and wondering was very helpful for him. And then moving fast forwarding to 3 years now, I was speaking to his OT, and he said she was telling me that this little kiddo was in a new class, and the teachers were new to him. He was new to the teachers, and he didn't want to leave mom. And so mom brings him to class, and the teacher was like, "Well, mom, you can just sneak out now. Like, go sneak out. Just go." And this mom so beautifully advocates and says, "You know, I don't think that would be helpful for him. Can I just say bye to him? It's okay if he cries. I just want to make sure he knows I'm not just leading him. And when I do have to go, please like use your relationship, befriend him, let him know that he's going to be okay, and then just remind him I'll be back after class. Just tell him I'll be back after an hour and I'll be waiting outside, and I'll be there for him." And so when I heard that, I was like, this is a mom who's valued the strengths of her child, who can recognize that would just cause anxiety for him. Please don't make me do that. And I thought that relationship part of it just really blossomed in that story that she was telling us.
I love that because it's so the opposite of what a lot of parents experience. And I'll refer back to the DIR dialogues on limit setting where we talked about this, how a lot of parents, and including me, I had a child who was extreme separation anxiety, and I was terrified to separate because of the crying and everything, the sadness. And my son had, seizures and was hospitalized for 4 months when he was 2. So going through that, I had the PTSD of being in the hospital every day and seeing him get IV changes and all of that, and just like my heart just dying, not wanting to see him suffer anymore. So um, it's amazing because that is one of the big fears that parents have, is this meltdown and trying to prevent it at all costs. But hearing that the mother said it's okay if he cries, co-regulate with him. And that's one of the things that is so valuable about floor time, is, getting through that co-regulation. And I'll link to the podcasts with the parents who did the intensives in New Jersey at the DIR
Mm-hmm.
Institute, because that's one of the biggest takeaways that I've heard many parents that have had the intensives say, is that they learn how to sit through those really hard moments of emotional disruption and, being so upset, and how to co-regulate through that. Because I think a lot of us as parents never had that as kids. It was sort of like, be quiet, come back when you're not upset anymore, and sort of forced to deal with that alone. So I love hearing that. I guess I wanted to say that it's so nice to see a medical doctor trained as a DIR expert and training leader, because I wish that more medical professionals in North America would train and be DIR. And I know, ICDL is working on that, trying to reach out to more, medical personnel. There's certainly pockets of people here and there that get that training, but that whole piece that Dr. Greenspan spoke about in many of his books is that whole biomedical aspect,
Mm-hmm.
that, we want to rule out, if there are behavioral issues, rule out some of these medical causes for them. And do you find that that's part of your work as well, is, finding out that maybe a child has gastro issues and that's why the behavior is happening, or maybe they are having seizures and that's why the behavior looks different, or whatever, things like that?
But that's actually an interesting question that you're asking. And I love that you're bringing it up because it's actually one of the research work that I'm currently doing, at least locally for the Philippines, is we're trying to do a profile of gut microbiome of individuals with autism and those without, and just trying to see what that looks like in terms of behaviors that we're seeing, and even in terms of other what we think might just be behaviors might actually be comorbidities, like in the medical field, those um, other diagnoses, let's say a gastrointestinal concern or a metabolic concern that children actually see, but we don't get to study very well because perhaps they don't sit well inside a doctor's clinic and they can't be examined as fully as well. But there's definitely now a link between what we know are medical concerns that affect that whole gut brain axis, that whole the whole idea of metabolic symptoms causing inflammation that affect how the brain might be interpreting information or how it's actually receiving and absorbing nutrients that is supportive of brain development and neurodevelopment as well. So it is a growing field. It's also novel. It's very new for us. I do get to see it more and more in clinic now, specifically because some of the clinicians in our clinic is they follow functional medicine. I'm not sure how common that is in the United States. I think it's growing. In the Philippines, it's definitely very new, but it's also supporting families that are looking into the biomedical parts of interventions as well. And I think it goes back to our model of DIR. It's the individual difference. It's that medical piece of the individual differences of children, that it's not just, oh, because you have autism, you're expected to have a GI issue, a gastrointestinal issue. But this picky eating that you are seeing has repercussions to health, right? It has repercussions to the food that you choose. Let's we McDonald's is also common for us. We've got kids who would prefer chicken nuggets and French fries. But if you think about the nutrients you get from there and how that affects development, that doesn't affect just children with autism, it affects every child. And so more and more we're just seeing the value of looking at nutrition and looking at gut health and looking at the entire medical picture of the child and being central, and then the relationship being central to, if I do need to help you eat a better meal, can I do it relationally? Can I introduce it to you in a more relational way, so that, because our value becomes we share meals together and you see me eating the healthy meals, can I coax you into enjoying this healthy meal with me? And that's just me simplifying it or oversimplifying, but I think of it in that sense.
I will refer people to the podcast I did about feeding and eating, a few of them with some of the other DIR practitioners who specifically work on that. And I believe it's mostly with OTs, but occupational therapists. But it's such a huge concern with autistic kids for sure. I guess I'm lucky because my son, even though he's definitely a picky eater, he eats a very big variety of food. And even though he doesn't like a lot of vegetables, he does love fruit. So he's getting, that's one of the things I remember they told us early on in a nutrition courses, you know, get him those fruits if he's not getting the vegetables, because at least he'll get the nutrients or whatever. But when you're talking, okay, so I have a couple of questions and I don't want to forget. One is about the functional medicine piece, and one while we're on the topic of eating. So, when we started this podcast, because I'm getting up early to do this podcast because we're 12 hours apart and we don't want to keep Dr. Angel too late, I, of course, with my executive functioning, was running late and was wolfing down my omelet at the beginning of our recording. And Dr. Angel said, oh, take your time. I want to make sure you're chewing properly. And it made me think of this question because my son, unlike me, because I'm usually not like this, but I was told his dad was like this as a toddler, just eats so fast. Like he's shoving the food in his mouth. He has like, it's like squirrels cheeks, and then he's like, and it's truly a choking hazard. And knock on wood, we haven't had any choking issues, but I hope I didn't jinx myself by saying that. But it's quite scary when you see, if you're not literally right beside him when he's eating, how fast he eats. The occupational therapist thinks that perhaps he has low registration in his mouth, so he's not feeling that urge to swallow until he feels the fullness or whatever. It could be contributing, and again, that's part, like sensory, part medical, whatever. So yeah, I think DIR works so well with that because we want him to chew slowly. We want him to pause between taking bites, but he's also very impulsive. So unless someone's right beside him saying, okay, wait, wait, and then, okay, now have your next bite. And he's 16 now. So, I mean, he can feed himself just fine. But needing to be there is where you can really pull in this DIR and make it relational and do that, playfulness around, wait a second, I'm not going to like imitate all the different things I might do, but anyway, how would do you notice this with parents is, besides the food selection, the process of eating is also challenging.
Yes, definitely. And I love your example because here, fed is best, is kind of what people say, right? So for as long as you wolf down the food and we got the calories in, which is also why a lot of kids in the Philippines tend to drink a lot of milk. If, let's say, they're not feeding well, they'll give the milk because the concern is the calories that they're actually taking in. And to your question about the asking you to chew earlier, it's because you have to. I'm coming from the idea that digestion starts in the mouth. So you've got to chew, break it down, let the saliva's enzymes break down your food, and so on and so forth. But most families are not thinking about it from that lens because the basic need is I need to make sure you've eaten. I need to make sure you've gotten calories. And we've got to respect that also, I think. So even though with all of this knowledge, I'm always trying to meet families also where they're at, whether we're able to get into this conversation of feeding. I usually gauge where families are. If they bring up feeding concerns, then that might be when I start introducing, hey, what about let us think about the more relational approach to the feeding relationship that you have, the child's relationship to food and the child's relationship with you about food is also something that we kind of have to tackle. But it always comes back to parents sometimes want to also prioritize, like, I'm already having a hard time. Um, I'd rather deal with toileting problems versus feeding problems at this time, but it certainly exists. Um, it becomes a longer conversation. I think it's also one of the reasons why perhaps as medical doctors, it gets a little bit more tricky and more challenging to think of DIR as part of the approach in clinic. I am privileged enough to have at least an hour with families. Not all doctors get to do that because it definitely doesn't, you can't have this conversation in 15 minutes. And with all the medical checkups and the vaccinations and all of the other things that have to happen. But slowly, at least in the clinic, we get this opportunity to sit down and have these conversations and just kind of see where parents want to be, where their kids are, and supporting and meeting them with that as well.
I love that because, like you said, there are so many issues sometimes happening that worry parents. My child needs to eat. I need to keep them safe. I need to, and parents often feel like they're not doing enough, and the last thing we want to do is put more pressure on them, like, you should be doing this. It's like, I think everybody knows the things we're supposed to do, but let's prioritize something here. Like, at least we need to get those calories in, and then the next step we'll worry about it. But having that DIR framework where it's not this demand that's placed on the child and eating becomes so stressful, and then that creates the whole snowball of other problems. So again, I'll refer people to the feeding podcasts I have a few of them, and they really go through and talk about those kinds of things to think about. But you brought up vaccines, and that circles back to the whole functional medicine piece, because how do you tear apart all of the pseudoscience that's out there, and especially in the United States now around vaccines and everything like that? It's like moving back in time, and it's so demoralizing to hear all of this false information that's out there. And sometimes functional medicine is gaining so much popularity, but then it's also associated with some of the naturopath stuff that is a lot of pseudoscience, and there's validity to some of it. And how do you separate that out for parents to figure out, like, what is valuable versus what is false hope that drinking this whatever supplement is going to make this go away? Not that there isn't value to certain vitamins, minerals, and certain supplements, but overall, I think the research pretty much shows that the majority of supplements are useless. So things like that come out as pseudoscience, all this pseudoscience that's out there, and so many people talking about it on the web, like, I did this and then my child was all better, kind of thing.
Yeah. I guess my disclaimer first is that I'm not a functional medicine practitioner. I've learned it to the point of understanding what it is they're trying to espouse and work towards, which I think has an overlap with DIR because it looks at the individual as a whole, which is why I love the practice of it in itself, but I can't say I'm an expert in it. But to answer your questions of, let's say, when parents come in and ask about, should I believe this? Should I try this protocol? And I got this book and it was and this supplement that was on social media. And just to let you know, the Philippines is like the capital of social media users in the world. And so there's a lot of, it's not Googling, it's Facebook here that I saw this reel, I saw this story. And so I always go back to individual difference of the child. So our conversations always go back to what is it that your child actually needs? Because what is being declared out there is actually never one size fits all. Um, an, a ch an autistic child will never be the same as their neighbor child. And another autistic child is always going to be different. And so that's also the way I approach families. And I think that's very helpful for me being a doctor to be able to say that because I could actually do a physical examination and let them know there are certain supplements that you actually don't need because I don't see the nutritional deficiencies that require it. And then in the functional medicine world, there are actual specialized tests, assuming they might have resources to check it. We can actually go even deeper in terms of individual difference of whether or not they will require that kind of supplement as well. So it's always trying to balance out and thinking about it from an evidence-based practice and literal evidence. Like if I can do a physical exam, or if I can do some laboratory tests that kind of help. Or for those who want to try it, it's also navigating what could be attributed to what they've tried and what could be attributed to many other things. And so it's always that it goes back to the relationship I get to form with families and trying to get into a more reflective conversation with them. It doesn't work all the time, but I think it's having that trusted relationship with the family and being able to have these discussions. And most of the time, given the time to talk to them and what brought them to this supplement to begin with, sometimes it's also just asking why were they looking in the first place, right? So for me, it's always parents come from a good place because they want to do well for their kids. And sometimes it's going back to that underlying reason of why they looked for it in the first place, and then just kind of guiding them into what may be more supportive of that underlying goal that they might have.
You are way more diplomatic in the way you talk about it than me. I tend to stick my foot in my mouth sometimes. So, yes, of course, I take vitamin D supplements. I can measure my vitamin D3 levels in a blood test and see if they're low or high. Given my age, I've now, started taking magnesium supplements and things like that. So, I I sort of said this like black and white statement there, but what I'm talking about is when you have people who would rather buy a supplement on Amazon because they saw a TikTok video than believe something that's credibly science based saying that, it could be a medical issue or whatever. That's the thing that I have the problem with is someone will take an unregulated supplement sold on Amazon over um, medical and scientific knowledge. That really bothers me. And I think the reason it bothers me so much is because I went through that with my son. I tried everything in hopes that he would get better. And again, he had brain inflammation and he was recovering from that. And then that was mixed in with the autism diagnosis. So it was like, is he going to recover and be neurotypical? And then realizing about autism and, my journey's been a long one. I document about some of this stuff in the book that I just wrote about doing floor time with him. But it was really my realization was when you have that idea of trying to cure your child in your head, that is a you issue versus a child issue. And that was hard for me to separate out. So I don't want to pretend that other parents don't go through the same thing that I went through, but because I went through it and it took me a long time to get over that and accept my child for who he was and all of his wonderful strengths that he has despite the challenges from his brain injury. I get really triggered when I see people just trying to, think that there's some magic pill to make certain things get better. So yeah, I definitely appreciate the medical perspective and realize that also, medicine can't solve everything either. I've had conversations with that with Dr. Joshua Fader on the podcast as well, about, medicine has, what do you call it? There's side effects to every medication and it's a risk benefit analysis. And I'll put links to that too. But any last things that you want to share about your work and about what your research and all of this stuff? Any last things you want to share before we wrap up?
Well, I certainly, well, I fell into the world of floor time, but it has been a growing experience for me from thinking about floor time in the beginning as just this tool that I could just use when I do an intervention program that I just kind of pull out and do as an interaction with a child in certain moments to journeying with so many families and realizing that I can actually think about DIR floor time as the basis of any type of interaction I kind of do right now. So I I invite families to continue to be curious about ways that they can support families. And I just love how DIR has become that source of inspiration and support for a lot of families. And this is me just empathizing with a lot of parents that yes, there might be pseudoscience and there might be that desire to look for cures for families, but I think DIR allows families to see their child in a different light and to see their families growing together in a new supported way as well. And so I think that's the beauty of floor time for me. And it's actually one of my goals to be able to grow floor time in the Philippines more and more. That's the reason why I became a training leader. And I'm so glad ICDL accepted me. And so hoping that we could have more and more of that in the country and Southeast Asia in general.
Fabulous. And I can't emphasize what you just said enough, that DIR provides this framework for a new way to see your child. Because in doing the We Chose Play Floor Time documentary, I went through videos of my son, and even right after his brain inflammation, when I'm doing early, before I knew about a lot about floor time, we were put in a Hannon program, and it's
Mhm.
very similar, more than words program. It's very similar to floor time type activities. And there's this video of me, and I'm watching my son then, and I remember in my head just thinking deficits, 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 catch him up, make him better. And I'm watching this video and seeing his beautiful FEDCs blossoming and not seeing that at the time. So had I had that framework at the time, I would have seen, like, look at the initiation he's doing. Look at that, FEDC3 is really quite robust, even though he was 2 years old, even though he just had a brain inflammation. Like, there was, he still had those strengths, and working from that. And so that, if I could go back in time, of course, and and again, we don't want to feel guilty as parents, but I hear this a lot of time. I wish I found floor time sooner. I wish I found floor time sooner. So I love that you're bringing this to the Philippines. I hope that parents that are interested, if you're listening to this and you're like, oh, I know someone in the Philippines, or family members in the Philippines, or you're in the Philippines listening to this, how do people reach out to you? Or
Well, they can visit the web page. So we started as a Facebook page that became a clinic later. So the Growing Brain PH is both on Facebook and on Instagram, so we're reachable there. You can also email us at info@thegrowingbrainph.com.
And I will put links to all of those in the blog post with today's podcast episode. Thank you so much, Dr. Angel Bell-D. It's been wonderful hearing from you, and keep up the amazing advocacy and work in the Philippines. It's awesome.
Yeah. Thank you so much. I enjoyed this conversation.
The 2025 International DIR Floor Time Conference, live online October 19th to 28th. A unique 10-day conference with dozens of engaging presentations on the practical application of DIR floor time for professionals and parents alike. Early bird discount if you register by October 1st for 20% off. DIR Parent Network members get 25% off. On Tuesday, October 28th, Dr. Robert Nassif and I will be presenting The Good or Bad, Hard to Say Parable, Navigating the Complexities of Autistic Support Needs. Hope to see you there. Thank you for listening. This episode of We Chose Play was made possible with the generous financial support of Affect Autism's members and of the International Council on Development and Learning, ICDL.com. If you liked this episode, please share it with someone, like and subscribe, sign up for the newsletter at affectautism.com, and follow us on Facebook, Twitter, YouTube, or Instagram. Find out more at affectautism.com. Until next time, here's to choosing play and experiencing joy every day.